I am Carlos Spironelli Ramos, and this is the second part of our presentation about the management of dental emergencies in times of COVID-19 infection. In this segment, I will talk about the last updates about infection control and details about how to proceed to break the infection chain at our office. Let's review the most important points regarding the infection control procedures and how to break the infection chain in our office. Of course, one of the most important things is to choose and wear correctly PPE. That stands for personal protection equipment. This is my dear friend Dr. Rodrigo Cunha using wisely PPE, even with a microscope, and his setup is perfect. We need to follow what is the basic infection control 101. To break the chain of infection, we need to understand how to deal with the main factors of infection path and be able to prevent the infection disease. So let's take a look in this chart here and see, for example, the reservoir. So the reservoir, which is the place or places where the virus lives, in our specific case are people and equipment. The portal of exit, that is the way that the infection leaves the reservoir, in our case through aerosols, splatter, and saliva. The mode of transmission, in our case, is direct contact with the patient. So we have to remember that special attention needs to be done on the correct use of PPE. This particular COVID-19 outbreak, there's a shortage of PPE available in the market. The good news is Medidenta is a official distributor of the FDA-approved Bright PPE devices. I will show later what Medidenta can provide in this sense. Interesting, because even during the discussion on the PPE requirements on the webinar provided by American Association of Endodontics last week, we could notice there's a different approach from Dr. Cunny, that is an infectologist, and Dr. Hargreaves, an endodontist, concerning the need of the N95 masks. This is the formal recommendation that we can see in all places now talking about the N95. Interesting, because I attend another webinar with Tracy Wales. She is a labor and safety engineer. She stated that N95 masks need physicals to be done before use, test to proper fitting, meaning special checks needs to be performed when you want to use this type of respirators. So we need to receive fit testing, receive training on COVID-19. So N95 is not a simple mask that you can just go there, put in your face and use. So later in the same discussion, Dr. Hargreaves came with these two studies showing that the difference between N95 and the regular type 2 surgical masks were not significant. He attests that there's no sufficient data to confirm that N95 and regular surgical level 2 masks determine different levels of protection in terms of the virus infection. That makes me wonder, and probably you as well, why in 2020 we have this level of uncertainty concerning this viral infection protection. I would say not only COVID, but hepatitis, influenza, all others. This is a serious matter since the Spanish flu during the First World War. Because we are healthcare professionals, we have the duty to keep high standards of care on infection control. So we need to be sure that we are correctly protected and we can protect our patients as well. It is amazing that we are back talking about aerosols and how to prevent contamination coming from our procedures that use high-speed handpiece or even ultrasonics. Should be something that we already have total control, since so many other diseases can come from aerosol and splatter. Just remember that by definition, aerosol and water spray are different. Aerosol is the suspension of materials in gas or vapor. In our case, saliva vaporizing air water spray coming, for example, from our high-speed handpiece. We can see papers back in the 60s showing the aerosol and splatter matter and highlighting the importance of control it and avoid the formation of aerosol in our office. In this study back in 1994 and published in the Journal of American Dental Association, the authors talks about the risk of cross-infections and possible places that will be contaminated after some procedures. The bottom line is there is no exposed place that is free from contamination after seeing a patient. This is the latest published paper about the persistence of the virus on surfaces and inactivation, published this year on the Journal of Hospital Infection. This is not specifically about the COVID-19, but gives us an interesting perspective of how similar virus can stay active on common places found in our office, surface like stainless steel, plastic, or fabric. As an interesting side information, reading the paper, you can find this interesting data. People touch their faces with hands 23 times average per hour. So unless you tie your own hands, it is very unlikely that you don't touch your face with your hands during the day or during the night. According to the study, virus can stay from hours to days in surface like stainless steel, for example. You can see plastic here 5 days, silicone rubber 5 days, even surgical gloves 8 hours. The good news is that some common formulations that we use daily are effective, like ethanol, for example. So even a very dilute concentration of sodium hypochlorite can be used and is effective against the virus. WHO recommends ethanol to inactivate the virus based on studies done with other COVID. Again, you can dilute sodium hypochlorite, and for me, this is another proof that there's nothing new or special about dealing with this infection in terms of infection control. Basically, it's the old infection control 101. Regarding the disinfectants to be used, fortunately, there are a lot of them being sold by medical and dental suppliers that we can use. So just check at the EPA website and see if what you are using is at the recommended table. Thanks for your attention. Join me in the last part of this presentation, in which I will talk about some tips on the emergency endo treatment, aiming less exposure to the potential infection. Thanks.